topic is metabolic alkalosis. The winner will draw the formula pH bicarbonate. Okay, alkalosis pH will raise. pH is more than 7.45, and it is due to metabolic. We call it as metabolic alkalosis. So bicarbonate is increased. Either bicarbonate is increased, or most importantly, the most commonly asked question will be bicarbonate increased as positive loss. A diseases in which as carbonate, hydrogen ion is lost, you will have increased the pH. Okay, here when we are having metabolic alkalosis, okay, remember as possible loss. Which one of them is the most commonly asked question? It is vomiting. When you have vomiting, you know there is acid present in your stomach. HCl is released in the stomach. When you have vomiting, H is released, chloride is released. Okay, so in vomiting, what will happen? You will have when H is lost, bicarbonate will be increased. Okay, when H is lost, bicarbonate will increase. So increase bicarbonate, increase pH. So you will have alkalosis. And you know, in vomiting, you will also in vomiting both H, H positive and chloride is lost. So in this case, you will have hypochloremia. Okay, and remember, K positive means potassium is also lost. So a clinical term is used in three words are used: hypochloremic, hypokalemic, metabolic alkalosis. In vomiting, in diuretic, okay, there will be 3 points. Remember, hypokalemic means potassium is lost, chloride is lost, so you will have hypochloremic. And then as positive is lost, so you will have a term they use that is called hypokalemic, hypochloremic, metabolic alkalosis. Okay, and guys, remember in one word there is a system will be activated. This system, like in this issues, it is the renin-angiotensin system. Whenever you will have dehydration, okay, I have described one aspect of this disorder, metabolic alkalosis, means you are losing chloride, you are losing aspartame. But other concept is important, that is the dehydration. Whenever there is dehydration, excessive sweating, vomiting, diuretic, in diuretic more urine is produced. In vomiting, H2 is lost, water is lost. What will happen? The renin system will be activated. The renin system, okay, the important component is aldosterone. That aldosterone actually try to absorb water, try to absorb sodium, and kick out potassium and aspartame. Actually, I am describing the like aldosterone. Aldosterone will kick out potassium, so you will have hypokalemia. Kick out H positive, so you will have metabolic alkalosis. Okay, so remember this is major aspect of this disorder. Okay, you will have dehydration, then renin system will be activated. In this case, actually chloride is going out, so you will have urine chloride will be decreased. But next is the also these are saline disease responsive. When you give the fluid, this alkalosis will be over. Next is the this disorder, saline resistant, hyperaldosteronism, Bartter syndrome, Gitelman syndrome. In all of them, aldosterone is high due to some other pathology. So they will absorb sodium, kick out potassium, kick out as positive constantly, not depending on the fluid level, not depending upon the dehydration. So that is a pathology. It is saline resistant. Even you give it the fluid, there will be no response. There will be no issue will be over. So that is the difference between saline responsive and saline resistant.